Now, the African continent is experiencing a full-blown third wave of coronavirus. The World Health Organization yesterday reported that the number of deaths rose by nearly 15% last week, with 2,200 deaths recorded across 36 countries. For more on this, I'm joined by Dr. Mary Stephen, public health expert at the World Health Organization Africa office. Dr. Stephen, thank you for your time this afternoon. Now, according to the reports, we believe that the rate of infection in other countries is actually declining. It's declined even in India. Why is it that the rate on the African continent is not following the same trend and trajectory?
Thank you for having me. Good afternoon. So the situation is different across the world. If you look at what is happening in the United States, in Europe, for instance, and India, and what is currently happening in Africa. So from the beginning of the outbreak, if you look at the way the outbreak was moving, it started from China and then moved to Europe, to the United States and other parts. Then Africa was the last continent to be affected. So they have had their third wave before us. Africa is just getting into the third wave of the outbreak, and the issues we are having with this third wave of the outbreak is the fact that the public health and social measures in countries have been relaxed. People are not so much complying with the preventive measures. And then we have this issue of these new variants, Alpha, Delta, and the Beta variant circulating in most of our countries, on top of the very low vaccination coverage we have. If you look at the statistics from other parts of the world, vaccinating about 68 per 100 doses received compared to about 2 per 100 doses received on the continent. So we are still lagging behind with regards to vaccination as well.
You're saying that even though the weekly numbers have escalated by up to 44% to 95,000 on the continent, WHO still believes that these are actually not the accurate numbers, that the numbers could actually be higher. Why?
It's possible because of the rate of testing. Ideally, the country should be testing more than 10 per 10,000 tests, but we are still lagging behind with this. So it's possible, if you're not testing very widely, to miss quite a number of cases. But you can also have a sense of what is happening by looking at the bed occupancy, the ICU capacity, the normal bed in hospitals. If you're beginning to run out of those beds, even if the test is picking fewer cases, you should know that there is a big issue that needs to be addressed. It means that the outbreak is moving very fast and circulating in the community.
What are the characteristics of the third wave on the African continent? Is the virus behaving in the same way that it did with the first two outbreaks?
Okay, so what we are seeing, the peak of the first outbreak around July 2020, we had about 120 cases. The peak of the second outbreak, early January 2021, we have about 220,000 cases. And now we are beginning with the third wave. We are already more than half the cases we have seen for the second wave, and around almost the same cases for the first wave. So it looks like we are going to have much more cases reported on the continent during the third wave. Like I said earlier, what needs to happen is to make sure that vaccination coverage is increased rapidly, and instituting those measures that we know already they work, finding the cases, testing, isolating, and the general population observing the preventive measures. It is not over yet. We need to wear our masks. We need to keep our distance, hand hygiene, avoid unnecessary mass gathering.
Now, in late May, the WHO said that Africa will need to vaccinate about 20 million vaccine doses by mid-July for patients to receive their second dose in order for them to have adequate protection from the virus. Are you in line to meeting this target that you've set?
So there has been a lot of effort in trying to access additional doses. You know, we had a setback when India had the resurgence, and the AstraZeneca doses had to stop. But as you heard from the conference last week, the G7, there has been a lot of donations that is coming through the COVAX to most countries in Africa, definitely lower income countries. So this is going to enhance this bilateral donation, the number of doses we have. But for us even to meet this target, as well as the target of vaccinating 10% as set by WHO during the WHO, we will need about 225 million doses for all our countries to get to that level of 10% coverage. And so we need many more doses for us to keep up with the targets that we have.
Now, there are many countries that have made pledges to donate vaccines and millions of vaccines to African countries. Why is it then that there's still a shortage of vaccines, even with all of these pledges?
Yes, so like I said, the estimation for Africa to reach the WHO target of covering 10% of the population by the end of September 2021, we need 220 million doses. Then for us to reach the 30% target by the end of 2021, we need 780,000 doses. So now with this bilateral donation, it's about 1 billion doses that, but we need these doses to get to the countries as soon as possible, so that countries would continue to roll out this vaccination and try to push towards these targets that we have.
Are we finding, Dr. Stephen, that there are a lot of pledges, but the delivery of those pledges and those vaccines is not quite timely?
Okay, so the pledges are there. The doses haven't arrived in countries yet. So this is why we are calling on the global community that that needs to be fast-tracked if we want to see increase in the coverage of vaccination on the continent in Africa. And this is very important as we are right in the midst of the third wave. With so much vulnerable population out there, it means that the virus can move very fast, infect so many more people. But if we have populations that are fully vaccinated, it will reduce the spread of the virus, of course, in addition to the basic measures that we have talked about earlier. So this, the need to get the doses on ground in our countries cannot be overemphasized.
And which are the vaccines, Dr. Stevens, that are most widely used on the continent?
On the continent, the most widely used vaccine is still the AstraZeneca vaccine. And then with the approval of the Sinopharm vaccine, we see a lot of African countries using the Sinopharm vaccine as well. But the countries are open to receiving vaccines that are available for them to move and increase the coverage of their population with the COVID vaccine.
Thank you very much, Dr. Mary Stevens, for that WHO Africa update on the state of COVID-19 on the African continent. That's Dr. Mary Stevens coming to us live there from Congo, Brazzaville.